Oh, no, it's going to be all right.
Testing 1, 2, 3, 4, 5.
We didn't have it.
Okay, we're about to start. Good afternoon. My name is G.K. Manius, and I'm with Tarrant County. And this is our 3 p.m. news conference as it relates to the H1N1 influenza. Before I begin the press the news conference this afternoon, I'd like to introduce Judge Glenn Whitley. He's in the back of the audience, and I believe he's the only elected official we have here this afternoon, and he'll be available for questions from any of you at the conclusion of the news conference today. I'd like to kind of go over the agenda that we're going to follow today. There'll be some opening comments that I'll make, then I'll turn it over to Lou Brewer, who, as you all know, is our Public Health Director, and she will give you the 3 p.m. update. At that time, at the conclusion of that, Dr. Sandra Parker, who is our health authority, will come forward and have some remarks and will be available for questions. In fact, Ms. Brewer will be available for questions at that time also. At the conclusion of that, then we'll have some concluding remarks, and then we'll conclude the conference. Just some housekeeping information. Yesterday we talked about moving this from a live press conference to a telephonic press conference, and we will begin that. We will not have a conference tomorrow, but we will begin that this Friday, and that will start at 3 p.m. We will notify you of the teleconference telephone number that you can call in on. Obviously, if there's an issue that comes up prior to then we will have another either telephonic conference or we will have a news conference in and of itself. So with that, let me go ahead and one other housekeeping item, as we did yesterday, and it worked out really well. Whenever you had questions, we repeated the questions so that we are streaming live, and so that our cameras and our sound system can pick up your questions. We'll do the same thing today. So with that, let's go ahead and get started. As you know, some things have changed from yesterday. We've received some additional information. I do want you to know that we are continuing to work with our community partners. Those include the health officials from the various counties surrounding Tarrant County, also included the medical community, and those individuals who are on the front line of this particular issue. We have worked diligently over the last 24 hours with our school districts as it relates to the new guidelines and recommendations that CDC gave to us. We received those at approximately 1 o'clock yesterday afternoon. As you know, we also released a news release last night at about 9 o'clock that indicated that yesterday afternoon we received indications from CDC that there were 26 confirmed cases, new confirmed cases. Of those 26, 14 were in Tarrant County and 12 were within the balance of the region. I think Ms. Brewer will be able to answer any questions you might have about those and may include some of that information in her update. I'll tell you that that even though we have these newly confirmed cases by CDC, these individuals had tested probable in our labs, and we were the ones who had sent those samples in. And this will not necessarily and does not change the recommendations that we are making to the ISDs. I believe that the ISDs have communicated with the press as to when they are going to be open. Some are opening today, some are opening this week, and some are going to be opening on Monday. So with that, I'm going to ask Ms. Brewer to come forward and talk about the 3 p.m. update.
Thank you, Mr. Manius. And I think you just gave my update, but several things bear repeating, because as we all know, the last 11 days have moved very quickly. We have learned quite a bit about this novel virus as a nation and as a community, and I just want to take this opportunity to thank all of our community partners who have been so supportive and so collaborative around this effort. We need to keep on keeping on and staying in touch and continue to watch this virus very carefully. However, what we know now that we didn't know 11 days ago is that it seems to be showing up as a mild virus, and that has helped to inform the CDC in changing their recommendations over the last week or so. As you know, yesterday the recommendations came out that schools could reopen. Dr. Parker and I spent quite a bit of time on the phone, not once but twice, with the ISD superintendents or their designees that we have been in contact with over the last 11 days. First of all, letting them know that the guidance was going to change, and then getting back to them and talking with them, answering any questions they might have to help to inform them about the change in the guidance. And again, I just can't say enough how responsive and collaborative and cooperative the school ISDs have been. As Mr. Maney has indicated, we did have some of our probables, and again, we're not talking about something new that we hadn't known about before. We're talking about probable tests that we did in our lab and that we sent to CDC. We got some of them back yesterday, and as we already pretty much knew, they came back as confirmed. So we were already taking action and responding to those probables based on the guidelines from the CDC. But we do have that information, and it is posted in our 3 o'clock briefing. 14 of these cases, we already had 8, remember, that we knew about. So the 14 yesterday, we had 1 in the city of Bedford, 12 in the city of Fort Worth, 1 in the city of Grand Prairie. Now, 10 of the ones in the city of Fort Worth were in the Fort Worth ISD, and the one who was in Grand Prairie attends the Arlington ISD. So I'll just let you know that. And then, of course, we're working on our probables. Our lab still is receiving specimens for testing, so we do have new probables at this time that we are investigating. All of that information is in our 3 o'clock update, and we'll be maintaining that information for you. Thank you.
Dr. Parker?
Just to clarify, when Ms. Brewer said that we knew the confirmed cases that we had just received from the CDC, that we knew that information already, she meant that statistically speaking, that we had thought that those cases were going to come back as confirmed, because the information that we had been receiving from the CDC was that most of the specimens, approximately 90% or greater, that had been declared as unsubtypable in a regional laboratory, the CDC was then confirming those specimens as positive. So not that we had that information earlier, but that we had suspected that information. So other than that clarification, do we have any questions?
You guys have been able to put together a common thread. I mean, it seems like they're pretty spread out through the county. Is there one common thread that links all these together?
Question is there one common thread that links all of these cases together throughout the county?
Not that we have identified to this point, but we are still conducting our epidemiologic investigation to see if we can find any common threads. I doubt that there would be one specific common thread identified.
No concern that when it's returned later in the year, that never works. It doesn't affect.
The question is, do we have a concern that if this virus comes back later on this year, that it'll be worse than it is now?
We do have that concern, and so we are trying to prepare for that. But we have no information at this point that would suggest that. But that is a concern that we are thinking about.
You notice there's still a gap in the numbers that explain why you're getting confirmed back right now. That is, what's the total number of pending probables the CDC still has?
The question is, what is the pending number of probables that CDC still has at this time? Let us come back to you. We'll answer that question. It's on our charts. We'll pick it up and get that to you before we'll have to do some math for you, but we'll get that number for you before the end of this news conference, okay? Other questions? Yes.
I noticed there's a 64-year-old on here. Is this the first older person we've had? And does that make any difference in how you deal with this?
Question is, we have a 64-year-old as one of the confirmed cases. Is that the oldest individual that has a confirmed case, and is that a major concern to us?
I don't know if it's the oldest confirmed.
Actually, we had a 77-year-old that was confirmed previously. And so, no, it is not the oldest one. Have we had any or do we have anyone hospitalized at this time?
Not to our knowledge, no.
By the way, I do have those numbers off the top of my head. We have approximately 66 cases that are still in the region, region-wide, that we're waiting results from CDC. About 43 to 45 of those are Tarrant County.
And I don't know that these 77-year-old that we had previously identified, I don't know if that is the upper end of the age range for the nation, because there are still a lot of specimens at the CDC to be confirmed. So while that may be the oldest at this point, that information could change.
Is there a development, are they trying to develop a vaccine for this strain at this time?
The question is CDC attempting to develop a vaccine for this strain at this time?
Yes, a vaccine is in development, but there is no indication on when such a vaccine would be released, and at this point there is no indication that that would be available for the fall season.
Everybody's talking about the schools and bringing students back. Can you give us an idea of what went into the new guidelines that's allowing us to bring kids back to school, and maybe for anybody that's worried out there about, well, kids are going to be out for this many days and now they're not. Can you give us an idea of the new guidelines and what went into that?
Question is, what has changed that has caused CDC to create these new guidelines?
The collective knowledge has changed regarding this new virus. Initially, when the decisions were made to recommend closures for school, there wasn't enough known about the virus at that time to determine its virulence, which means its severity in individuals. At this time, the CDC has determined, and it appears that the virus is mild, much like an annual seasonal influenza, and that's what has changed the guidance, is that the cases that we're seeing in the U.S. If everyone remembers, approximately a week ago, we were hearing reports of more severe cases in other countries, and that was And that information was being factored into the guidance at that time, because we just didn't know enough about it.
Other questions?
That's it.
Well, I was wondering, with regard to Fort Worth ISD, when you look at the probable cases, was there concern about siblings and feeder patterns with regard to school initially?
The question is, as it relates to Fort Worth ISD, was there a concern when the probables first began to appear with siblings in the feeder schools that fed into the schools where we found the probables?
In the Fort Worth ISD, there was a concern because of the number of cases that we were seeing in different schools. And yes, it is reasonable that there would be siblings in other schools, but it was particularly the number of cases that we were seeing in a number of different schools.
Now that we know how mild the virus is it important to take the same precautions as wearing the gloves and the masks and the hand sanitizer and the constant washing of the hands should be done, but should we take it to the level that we have over the past week?
The question is, because of now that we know how mild the virus is, should we take the same or greater precautions or less precautions than we had before we knew how serious this virus was?
Specifically speaking about masks and gloves, the CDC has not changed their guidance on that, but given that there have been recent changes in the guidance for school district closure and how to treat this virus, I believe that that guidance will be forthcoming and that the use of N95 respirators, surgical masks, things like that will eventually be released, and so that I would think that most people are not using those precautions anymore. As far as the precautions regarding washing your hands, cough and sneeze etiquette, those should be practiced all the time, whether we're in flu season or not, and whether we have an outbreak of H1N1 or not. That's just a good measure to keep everyone well.
Yes.
Are you all asking doctors to conserve the antiviral medication?
The question is, are we asking doctors to preserve the antiviral medication?
The recommendations are that we need to use that more judiciously. In the beginning, last week, again, when we did not know what to expect with this virus, antiviral treatment and the use of antiviral medication for those exposed was used differently than we are recommending it used today. But as far as conserving it, no, we're not recommending that providers do that. But the guidelines have changed to allow for more judicious use, similar to what you would see in annual influenza, meaning that only those who are at high risk of complications from such respiratory illness receive that medication. But it is a decision of the individual provider.
Tony.
Given that CDC, we know CDC is changing some of their guidelines and that they have more information about this, what do you say to folks at the local level, since the number of confirmed cases jumped up recently with some results coming back from CDC, simultaneous to the fact that we're sending kids back to school? What do you say to the public to sort of ease their concerns? Hey, the numbers look like they might be jumping up, but then we're sending kids back to school.
What is the message? The question is, what is the message that public health needs to present, because taking into consideration the fact that we are receiving more confirmed cases, yet at the same time we're seeing basically a step down in the severity of the virus itself, and maybe a step down in some of the precautions that we're recommending?
The message that needs to be given is that this isn't unexpected. We did expect for this to happen. When we were identifying the probables, we sent them off to the CDC, and the information that we were getting is that a high number of these cases would come back confirmed. There's been a time delay in receiving the information about the confirmed, but the news about the confirmed does not change the current management of what we're seeing. We have still learned that the virus is relatively mild, and thus the changes in the guidance. But the number of confirmed cases isn't unexpected at this point, based on the tests we sent to the CDC.
Yes, ma'am.
over? I mean, you have to get down to the very last case comes in, you're not getting any more, it's done, or is there a formula that says, no, it's slacked off now, it's coming to an end?
The question is, how do we know when this thing is over, basically, and what type of data do we need to see in order to say that this thing is over?
Well, similar with the seasonal influenza surveillance that we do, we notice that people, by the reports for our doctor's office that send us information on a regular basis, we notice that people are no longer coming in for respiratory illnesses, and they're no longer sending in the specimens, the nasal specimens that have been sent in number according to for this outbreak, but we just noticed that people aren't coming in for those symptoms anymore. They're not coming in with a cough or a cold in the numbers that they were before. And so it just dwindles off itself. That's how we know it's over.
Has the lab reached capacity on testing?
Question is, has the county health department's lab reached capacity on testing at this time? Do we have any backlog?
No, we do not have a backlog. We have tested all of the specimens that we have received. There may be some testing right now, but we have tested all of the specimens that we have received, and there is no backlog of waiting tests.
If y'all still encourage the doctors to send those to you?
Are we still encouraging the doctors to send those to us?
Yes, but again, the guidance regarding what needs to be sent in has changed. The CDC has reported that you should triage the specimens based on severity. If someone who is hospitalized and you think that they may have this illness, then they're recommending specimen collection and testing on that. But now they're not recommending that everyone who presents with an influenza-like illness and mild symptoms present. We know it's out in the community, so we know it's there now.
I think one of the things, if you look at our matrix that we have not only on the screen in the back but also on the website, that first column as far as samples received from the region, you might note that while yesterday we had 86 samples, today we had 50 samples. And as we spoke yesterday, that's going to be a column that we're going to watch very closely. Because basically what that represents is that individuals who have presented themselves at their doctor's office or at an emergency room or at a clinic, and they have done an initial test, and it's confirmed that it's an A strain, I believe, and then they send it to us for testing. That's what's hitting our labs. And while it peaked on the 30th and the 1st and the 2nd, it seems to be starting a downward trend. But I believe, as Dr. Parker said the other day, one number does not a trend make. So we're following that number very closely. We're also looking at the other columns, especially the ones that are showing probable. We're seeing that they are diminishing somewhat also. So those are the type of things that public health and the epidemiology community will be watching to see just how severe this thing is or how long-lasting this thing is. So when we see a drop in those type of numbers, we'll have a better handle on if this thing is slowing down. Yes, sir.
Well, we've seen a downward trend about the time that schools closed. And so if there's an upward tick again, does it send a message to you about concern about what impact closing the schools may have had on controlling it or isolating the spread?
The question is, we've seen a downward trend since the schools have been closed. If the schools when the schools come back into session, if we see an upward trend, does that tell us something?
Not necessarily. It would depend on the population where you're seeing the upward trend. If it happens to be in school children, that would have to be something that we would need to look at, just as we did before. Are they clustering in a specific school, a specific area, or is it not even in the school-age population? So we would have to look at the information at that time to determine what might be a factor.
Yes, ma'am.
When explaining to the public how mild this virus is, what other disease or illness would you compare it to on a level of severity?
The question is, because of the mildness of this virus, what other incident or what other illness that would you compare it to?
You could say it's comparable to a mild seasonal influenza. You know, during some seasons of flu, we say that it's been a severe season of flu. We've had a lot more flu cases. At this point, I think we could say that it would be a mild season.
Do you think if it comes back in the regular flu season in the coming months in the winter, the public will take it as seriously since this turned out to be a mild seasonal influenza-like sickness? Or how do we stress to the public that to take it seriously each time an outbreak occurs?
So the question is how would we, if this comes back as a more serious virus in the future, how will we stress the importance for the public to take that seriously, because we've had a mild session of it this time? Is that pretty close?
But one,
Sort of like the hurricane watch. People ignore after too many warnings.
exactly, and that is a concern that we have, especially a gentleman asked the question about, you know, if this follows another pattern, then it could be more severe in the fall. So that's a concern that we have, and we just want to remind people to be aware of the surroundings and, you know, continue to practice the good hygiene measures and to listen to the message at the time. It is a concern that people won't take it seriously, but I can't tell you anything specific right now that I could say to change that. I don't have any information that would support a different response at this time. I would just hope that people understand that when decisions were made during this outbreak that we had, it was based on the information we had available at the time, which is the only way that you can make a decision. You can forecast, as in the weather, but we all know how well that works out at times. So you base your decisions on the information that you have at the time. So I hope that when that time is there, when we're making decisions, that people just listen to the information and listen to the reasoning behind it.
And of course, we will continue to stress to everyone that they need to be cautious and on guard for this particular illness. We will do that through public service announcements. We'll do that through the media, through news releases, and any other forms that we might have. We also have a telephone call line at the health department that is available for individuals to call if they have questions relating to this. Yes, ma'am.
What can calm someone who's worried about the virus, considering that there have been deaths? Considering, like, how could they see it as a mild virus if there is deaths caused by this one?
Well, because unfortunately there are deaths caused by the annual seasonal influenza as well. And so the fact that there are deaths related, while tragic, it is an event that does occur every year with annual influenza. And so the fact that there are deaths associated does not necessarily make it more severe. Unfortunately, it happens every year, and that's why we encourage protective measures like vaccine, although I don't want to confuse anyone. There is not a vaccine available for this at this time, but with annual seasonal influenza, we do have a vaccine that we offer every year, and we still encourage all of the same measures. Stay home if you're sick. Don't send your child to school if they're sick. Wash your hands, wash your hands, wash your hands, and practice good cough and sneeze etiquette. Those are ways to stay healthy.
Other questions? Okay. Thank you, Doctor. If I might just say several things. First of all, as I said previously, we are going to move now from a normal news conference to a teleconference, basically, that we will start on Friday at 3 o'clock. I'd also like to tell you that on our website, while we have had a matrix, and hopefully that was informative to all of you, because we're moving to this telephonic news conference, we are going to add to that matrix, and hopefully it will provide even greater clarity than what we have currently. So you will see that, I believe that we have it, so it'll come up tomorrow, It may actually come up sooner than then, but we know for sure that it'll be up tomorrow, and it'll answer some of the questions that as far as the numbers that you asked today. So with that, if there's no further comments or questions, then this news conference is concluded. Thank you.